Yeah, so you mentioned the idea that our field has really been exploding, and I think you said it very nicely. A lot of new things. No, we have exploded. It's completely crazy in clinical practice, the number of options available to patients, and it can be extremely overwhelming to them. In addition to that, we've had some new insights with label updates. For example, leronumab has a new label update with hypertension. It's kind of really threw a ripple through our community. It was unexpected, and it's the idea that we knew there could be unexpected outcomes in the long term, but we weren't sure what they would be. And so what you see in a lot of the data are these trends. Here we've exploded as a field, but what does that mean? What does it mean if a patient's on one monoclonal antibody versus another? Is there a difference if you start them on one and you switch? Is there a selection process that goes into play? Are there specific providers who are combining medications? So for example, on a botulinum toxin A and a CGRP monoclonal antibody combination, there's several abstracts talking about clinical experiences, safety, efficacy, but also who are those providers that choose to put patients on a combination? Are they headache specialists? Are they general neurologists? What are we looking at there? So you have a number of abstracts presented like this. We also have clinical experiences that are going to be presented about the new acute treatments, and I think this is great. In a matter of months, people were able to produce literature talking about their personal experience in clinic, about safety and efficacy, about the new acute treatments, and I'm looking forward to seeing what others are experiencing. And like you mentioned, we somewhat lose the experience to go and talk to people live about these things, but still seeing their experience really helps you bring home, all right, well, maybe I couldn't talk to that person who presented the abstract, but I did watch the abstract and I see this is what their experience is. So when your patients ask you what others are going through, you can talk about your own experience, but then you can extrapolate and say, I've also been to a meeting and I see my colleagues who've presented this data and it seems this experience is universal. And I think that's wonderful. We also have some data being presented on combination of these new acute treatments with other medications, preventive treatments that are in investigation right now that are being combined with common acute treatments. For example, atogepant, a new CGRP receptor antagonist, is being looked at with combination with naproxen, something we probably would do all the time in clinical practice, but what does the safety data look like? Lasmiditan in a patient who's already on a preventive, what does that kind of safety data look like? So I think that's great. We're going to have a number of these abstracts that we can really delve into and allow us to talk to our patients in a different way.